Welcome, everyone, to the Transformation Nurse Academy podcast. This is our weekly episode, Talk with Kevin, where we cover topics for all nursing fields with extra emphasis on emergency and critical nursing. Get ready for candid discussions that explore the vast landscape of nursing and beyond.
My new podcast is called Transformation Nurse Academy because I want to transform nursing. I want to because I see what you see. Like we have educators. I talked about this yesterday. We have educators in the hospital in each department, but they never come and educate us. They're always just saying, "Michael, you got your HLCs are due. Hurry up!" But they never come and teach you anything. So why the
Yeah,
fuck do we have these educators if we're not using them to educate
they're
people?
they're honestly there to like basically record KPIs and do gap analysis, but not have any
One hundred
knowledge of
percent.
what's happening in the weeds.
So I talked about that. And I don't not saying this for every manager, but managers and charge nurses, they become these leaders, but there's no leadership classes on how to be a charge nurse, how to be a
Nope,
manager. Most of them don't even know their own fucking policies. And they're
nope.
telling these nurses, like I had a new nurse yesterday. She works as a charge nurse in the red zone. I don't know if you know what a red zone is, but she works in
That's
the
the
red
hot
zone of,
zone.
yes, she works in the red zone at CRMC. She's only been a nurse a year and a half. She's already fucking charge nurse. And
That's
she said,
why.
that's what I said. And she said her preceptor told her that if she has a patient that needs to be defibrillated, she needs to wait for the residents. I'm like, the fuck
Wait for
you
the
wait?
residents.
Yeah, I'm like, if you waiting, you're delaying care, and now your license is gonna be in jeopardy. I said, stop listening to your stupid preceptors and charge nurses and read your fucking policy. Like, that's what's gonna
Yep,
get you out of trouble. But
yep.
I don't know. It's crazy, man. It's
But
crazy.
you're right. People don't even know their own policy.
Yeah. I asked people that. So if you were came to my class, said, Michael, how long have you been with the what is it called? Is it I even looked at it right now. WCRN.
Well, yeah.
How long have you been, Michael? How long have you worked for the WCRN?
2 years.
How many policies have you read?
I've written 10.
Oh, see, you've written them. So, but most people, what will they answer me when I ask them that question?
None.
Right. And I'm like, you've been there 2 fucking years. If you would have read one policy, just read one every day you go to work, you would have already read the whole damn
Well,
manual back and
the
forth.
problem is, they do have certain things that they review during a new hire. It's all the sexual harassment bullshit,
Right.
how to do your timekeeping, how to do the
Right.
EHR system. Now, where the hell are the SOPs related to your department? That's never
They're
done.
online. They're online, and you sign a piece of paper that you're gonna go and read them. And
Well,
then people tell me that they don't know how to find them, but they teach you that in that first week of
hmm,
training where to find them.
yeah.
I eat, sleep, and drink policies because I love it. I use it to fuck with the manager.
I on a daily basis have to respond to sponsors and CROs
Right.
or study teams about whatever we're doing, right? Updating them on this and this and that. And it's funny how like my perspective is compared to what really happens on their end. I will answer their email the same day, most of the time, because I try to clear my emails by the end of the day.
Yes.
I even come home and make sure they're cleared at
Yes.
night and or unread them so it's like they're still there in the morning so I can go right to it.
Right.
But these people like they
Miss
take
Pat.
weeks sometimes and it's like, why? What are you doing? And
Did
then
you hear
like
that? Did you hear that, Miss Pat? Keep
and
going.
I'm like, I have signature lines like with my cell phone and this and
Right.
that. Some of them don't even have a number, or they
Right.
they have they're like hiding behind their voicemail. You
Right.
know, it's like, I know damn well that you're sitting in an office somewhere, you don't talk to people or whatever, you're just doing this and that, and you don't have time to answer your phone. It's
Right.
ridiculous.
Right.
And it's funny how sometimes when they do answer their phone, they're like, oh shit, my phone's
Right.
ringing.
Right.
I gotta talk to a human.
Right. Right. It's true though.
I
I have it all the time. Because I send out
yeah,
emails to people like Miss Pat. She got like 12,000 emails. That's why I keep saying Miss Pat. She's the worst. I'm like, read your
mm,
fucking emails. Like, what's wrong with you, lady? I
yeah,
said I got zero emails in my email. Like, I mean, I have emails, but they're all read. I answer right away.
That's right.
People are surprised. Like people text the company all the time. I'm always answering. Like I'll answer
Yep.
at 2 o'clock in the morning
Those
if
who
I'm
are
up.
listening, he's not lying. I can vouch for that.
I didn't make you feel pressure, did I?
No,
I mean, I didn't bust your balls or anything. I just
no,
asked.
sir.
I mean, I
Ne-
didn't
n-
ask you. I asked
you know who did was?
I
I'm
asked
gonna put her
Mackenzie.
out. Nelly.
Oh yeah, yeah. Well, cause she asked me because I
She
left
didn't know
early.
that we were talking like separately.
Well, she wanted to do it together with you, and I said, "Well, Michael wants to do it at 7:30 in the morning, because I know you probably are like me. You get up early and stuff.
Right.
Nellie wants to do it at 6:30 at night, so I guess she's not a morning person.
Yeah, I 6:30 at night don't work for me because I got my daughter crawling all over me and all
Yeah,
that
yeah.
stuff.
I got. That's
Ain't
why I
ain't
said
gonna work.
yeah. I told Nellie, Michael and I do it this morning, and you and I will do it tomorrow afternoon. I'm okay.
Yeah.
I don't know how I messed her name up because I said it. I did an episode already on you and Nellie and Mackenzie, but I really tortured fucking Mackenzie's name. Pronounce her last name for me. I'm fucking white.
Villalobos.
Villalobos. I don't even know what I was thinking and stuff, but I must have been drunk. So
Yeah.
thank you, Mackenzie Villalobos from the Women's Cancer Research Network. I appreciate you getting me and Michael together. So, all right, so let's
Well,
start. Yeah, go
Kevin,
ahead.
honestly, like you gave me your business card. I reached out to you, I think, the next day,
You
and
did, yeah,
you know, I'm a man of my word. I wanted to do this and didn't have a chance during the conference. Like I told you, I
yeah.
felt like I was at
I
a
know. I saw
reunion
you. You're like a
with
little
my
giddy
old
schoolgirl
homies,
with
you know what
all
I
your
mean?
friends and stuff. I saw that.
Yeah. And you
The only
came to me when I had a fresh plate of food. I'm like, man, I gotta eat this.
hey, that's where you get people's best interviews. You catch them off
Oh,
guard.
when they're yeah, yeah,
See, I'm good at this. I know when to catch people. I'm not shy
yeah.
though. That's where I get in trouble. Like I'm not shy. I don't care. What's the worst thing you could have told me?
Nothing.
Yeah, you could say fuck you. I don't want to do it because I was a little disheartened. Now, don't be mad at me. What the hell was that lady's name too? I even talked shit about her in the first episode. She's the one that did the tumor lysis syndrome.
That's Cheryl.
Cheryl. Yeah. So thank you, Cheryl, for not doing my podcast. I really love you. Mm, I wish you could see my eyes rolling. But I do love Cheryl. Like she was awesome. I loved that. But I asked her to sit down and talk to me about it, but she wouldn't because she said she didn't want to be famous. I think that
She is famous and
I
she's
know
hella
that already.
intelligent,
I know that's why I wanted to talk to her about it. So I think it's because she's a chief nursing executive at Kaiser. So I understand.
maybe.
Once I found out that, I said, yeah, I guess maybe she don't want to hang out with the riffraff and maybe get a bad name and shit. So I get it. I don't take it personal, but I would have liked to sit down and talk to her about it because I was fascinated by that section of the class.
I was too. I even liked the other gals about the Wildebrands. I mean,
So
von
the
Wildebrands.
Wildebrand was hard for me to hear. I couldn't hear her very well. I wish she would have talked louder.
Well, she had a thick Filipino accent too.
Yes. Yeah. So
But her slides were on point. I was like, I learned something, I ain't gonna
right.
lie.
Even me.
And especially with Cheryl's, I learned something. And
I did too.
I think we all brought that to the table that day.
I don't know
And
if you, yeah, I don't know if you know him. His name's Mark Steven. Do you know who Mark Steven is? You ever heard of him?
where's he?
He's a flight nurse. He's here.
Uh,
He,
I
I
do
posted,
not.
uh, I posted a picture about the conference, and he said, just had a patient the other night with tumor lysis syndrome, and I haven't seen this since nursing school. I was like, holy
Wow.
shit. So that's why I was fascinated because as an ER nurse, we might see it. Because that was one
Right.
thing I asked you and Nellie. Why? Because somebody asked me that when I posted that I was coming to your conference. Why should me, an ER nurse, care about cancer and cancer patients?
That's an easy question to answer. I mean,
Answer that for us.
it's assumptive that, they're gonna go into the outpatient clinic and just get their therapy and go home and be all hunky dory. You know, Antibiotics and other like standard of care drugs and other diseases, everything has a side effect.
Right.
And, there's a risk versus benefit. And, what chemotherapy normally do historically? I mean, especially, let's go back, 10, 15 years ago when we had less antiemetic drugs
Oh
and
yeah, that's right.
less long acting antiemetic drugs. So you would see them like on the daily just barfing their guts out, or
Right.
having like massive diarrhea because we didn't have like standard protocols um for like antiemetics, hydration, pre and post chemotherapy, and or like telling them to take Imodium or something for loose stools and setting that up, or even writing prescriptions for like Lomatil or whatever. So,
So let me
it's a
ask you a
very important
let me ask you a
to
stupid question though.
yeah,
You said protocols. So do you have protocols in place now, like for your
there
chemotherapy
are a
patients?
lot of standard protocols that hospitals now have for certain highly emetic treatments. Absolutely.
Okay.
Absolutely. Um, and then there's some doctors that are more keen to it and more proactive. So, you as an ER nurse are definitely seeing that the population of the nausea, vomiting, and diarrhea for sure. Tumor lysis syndrome for sure. And then, in my arena for clinical trials, you know, nobody knows what the hell's doing that. So, because I'm doing phase 1 through 3, so phase 1 are first in human. So all we know is what adverse events happen to the hamster or to the beagle or
Right.
whatever. No, I'm serious.
No, I know. I
Um,
believe. I'm not
because
making funny. I love it
because
because
this is
people don't
this is
realize what
first
you
in
do.
human trials, and
Yeah.
sometimes even with that investigator brochure from the phase, the animal study, we really don't know because our physiology is similar,
But
but
not
similar
this.
ain't
Not
the
quite the
same.
same. Right. Right.
And the fact of the matter is those animals are infected with vectors.
Right.
They are healthy animals that don't have anything going on with them, and they get infected with like triple negative breast cancer to do this triple negative study, right? And
Right.
that's the fact. I mean, I don't know if
Right.
people know that, if it's common knowledge,
They do,
but
but that's where all these other organizations get crazy and shit because you fucking with I mean, sorry, messing with the
right.
animals.
Right,
Get
right.
that
And
out
they
you.
they they do have animal organizations, and you know what? I could have went on side discussions about that, but I would have been talking for hours.
I
Do you
know.
know what I
I know.
mean? It's so hard to like put something concise. So,
I know.
um, you know, with protocols that are clinical trial protocols, they have to have with them when they sign the informed consent form a patient card. The card basically says, I'm subject number 101 and I'm on this protocol. So they are told from day one to hold on to that and to bring it to them wherever they're at. So, you know, our job as researchers to educate them of each cycle visit while they're getting these investigational products. If you by chance have an issue and have to go to urgent care, your PCP, who's not your principal investigator for the trial, and or ER hospitalization, you need to present them that because you
So,
might be going to a center that's not in the same EHR system, and they have to know what what you're doing. And so, like,
what
I
would I
don't
do with
know,
that
like,
card though? What would I do with that card as a nurse if
so what you
somebody
would
gave it to me?
do, I mean, and here goes the awareness. You came and saw my talk. I've been invited by sponsors to discuss a clinical trial and investigator meeting. So investigator meetings happen after a trial starts, and back in the day before COVID, they'd fly us out to Copenhagen or Germany or this or that. It's like wherever the company's usually based is where they would
Right.
have it, and it was super cool. The coordinator and the principal investigator would go out there, meet all of the people on the study team, all of the vendors related to the study, like who does the EDC, the imaging, the lab, and all that business, right? The payments, yada yada, and it's great. But fast forwarding to COVID, and recently they've gotten really lame and they've been virtual. So I had
Tell-
I had at my old job, we did a Pfizer trial,
Mm.
and it was a phase 1. We randomized the first patient in the world, and they were asking me from a site perspective, like how we went about screening patients and what our hustle was. So I was honored to do that. That was kind of like my first, I guess, speaking per se. You
That's
know,
nice though.
I'm used to speaking in groups, but I'm used to being the man. You know what I mean? And I'm just
Right, right,
talking about what I know. And
right,
in my and it's kind of like you know, you live and breathe what you do. It's very fluid. And I
right.
was the same way, but my arena was the skills lab at Fresno City College. So I was clinical adjunct there. And it was fun,
Right,
you know? I loved it, you know? And it was funny, like, you know, there's like I called them my kids, right? But it was
right.
funny. I'd have students that were kind of older than me sometimes, you know. You get these housewives that are like, you know, they've raised their kids and then now they're finally going
Yes.
back to school, and you got this 40-year-old or whatever in nursing school that it's not far-fetched. It happens all
No.
the time.
Yeah, I'm getting a lot of 50-year-old women coming through my classes now because just what you said. Yeah,
Exactly,
yeah.
exactly. So those are like kind of my first things. And then now, since I'm in clinical trials, I have participated in conferences called Magi. And Magi is a conference that's done by WCG. WCG and Avera are like the two conglomerates of international review boards.
Hmm.
So WCG has their conferences, Avera has theirs. So I've done like session chair, and then I've done panel discussions with them. So this was like my first speaker not being on a panel. You know what I mean?
Right.
So I kind of had some nerves about it, you know?
No, no, no. I get you. But how did
Yeah,
you? So tell everybody. So first, tell everybody what company you work for, if you can. I don't want to get you in trouble. And then tell us how you got in it and why you decided to get into that.
that's an interesting story.
I,
So I
I
work
got
for
as much
Women's
time as
Can
you. So you whatever,
yeah,
whenever you got to go, you tell me. So
I work for Women's Cancer Research Network. So Women's Cancer Research Network, the background on that. So Dr. Perkins, my CEO, he was a general hemonc here in Fresno for many years. And his last part of his career, he focused on breast and gynonc. Um, he was part of a network through UCLA called Tori, and they did it was a cooperative study with multiple sites to do the Herceptin trials. So he was part of that initial Herceptin trials, right? And a principal investigator for that. And our board members, as I discussed in the talk, are from Stanford. Dr. Oliver Dorigo, Jonathan Barrick, they're part of Koji, which is the Gynonc surgical group. They're both like attending physicians, researchers, principal investigators, and then Mark Pegram is a breast surgeon, part of
hmm,
Stanford. So, you know, for years they've been trying to get him to go to Stanford and assist them with clinical trials, you know, breast and gynonc focus.
right,
And, you know, Perkins was like, well, you know, he wanted to do it, but you know, he at that time he was in Fresno, he had like a ranch and you know,
right,
he's
right,
like, well, if I like leave this and go over there, I'm going to be like spending $10,000 a month in Palo Alto or Los
right,
Gatos to live in an apartment.
right.
And he's
It's true
like,
though. That's right.
yeah. So he's like, you know, that didn't happen. And then fast forward to, you know, about 3 years ago, Sante, who's a practice management company locally in Fresno, you probably
Right.
know of them.
That's the one that had the
They
big
had,
split with CRMC and Valley
yeah,
Children's. Yeah, yeah.
yeah, I don't know all the details about that, but that's
I
the
don't
same
either. I'm
place.
staying out
Yes.
of that.
Yep, I'm gonna, yeah, deflect.
Yeah.
Um, Sante had raised some money through the Sante Foundation. And, you know, Dr. Perkins had gone to them, and this was money that, you know, physicians had kind of put into there, right? And he
Right.
was one of them. So part of the funds that were in this, you know, pot of gold were from his practice, you know, because he was part of the Sante group. They were his practice management company until like, earlier this year.
Right.
And so he went to them and said, hey, you know, I'd like to do, you know, a research project, you know, that's for these funds. And, you know, so he's at his office. And now at his office, there's like some people that were at C Care that I had worked with,
Oh
right?
yeah. Yeah, yeah.
And so I had some of my old colleagues working there. He's in a meeting and telling them, we got these funds. I want to do research here. And who do I get to do this? And like two of the nurses there, oh, you got to call Michael. And then so she calls me and I'm gonna put her on blast. Crystal, it's your fault. Um, she knows it.
What's Crystal's
She
last name?
she's Filipino,
Oh,
Bartolome.
Barta. Okay, okay. Thank you,
So
Crystal.
great gal. You're gonna meet her one of these days in passing. She's out to do big and good
I
things.
like that. It's good.
So she calls me and said, Perkins wants to talk to you about doing trials. And I'm at this point, I'm at C-Care and I'm the clinical research nurse, was the manager, and there was some stuff going on there. But I said, I have a job, what do I need to talk to him for? She said, I'll just talk to him. He wants to, get some ideas from me. I'm like, yeah, okay, sure. So this is what happened like 7 interviews later
Holy
because I was
shit.
grilling this guy, I and so I'm
Wait, wait. You're
I'm
telling me you're
always on.
busting the chops of a doctor?
Well, absolutely.
Yeah.
No, because I'm trying to scare him because it's a big endeavor,
Right.
it's a lot.
Right.
And you know so here we are, I was the first one hired, by myself.
So
Got
Dr.
it.
Perkins is the one who started the Women's Cancer Research Network?
He is the one. He's the
Holy
the
cow, that's
CEO and
nice.
co-founder.
And he brought
Absolutely.
you on, he brought you on along, or you guys did it together, should I say?
Yes,
See, that's
absolutely.
amazing, dude. You not do you
It's
not realize what you just said?
I
You,
know what I
Michael
said.
Mott, little old RN from Fresno, California, helped build the Women's Cancer Research Network.
That's right. But I
That's
didn't do it
crazy,
by
dude.
myself.
I know, but that's crazy, dude.
I brought in some really, really, really good people that helped get the SOPs done, helped run the regulatory and clinical research coordinator position. Hello,
Right.
you in the background?
uh, Ariana, Michael said hi.
She's out. I don't want
Michael
to be
said
on
hi.
this. She's like, I don't want to be on this feed.
That's my right hand woman right there. She's the one who keeps me out of trouble. Her and Miss Pat.
Okay, that's good. That's good.
That's crazy
Yeah,
though. I love that
we
though.
all
That
need
you,
those.
yeah.
Yeah, I
I,
honestly I can't believe that we did it. It was so much work and you know you always have like a lot of walls and things and in our industry and probably in yours too, you want things done yesterday, but yesterday
yes,
is the way everybody thinks and works, right?
yes.
This doesn't happen.
It
Eh,
gives me ulcers.
Yeah, it does.
Well, you know,
I needed a beer yesterday after I got off work, and I honestly didn't even have time. I had to go to Candy Cane Lane and all that,
oh
and
shoot, I
maybe
don't.
maybe today I'll get a beer.
I'll buy you a beer. I haven't
Sounds
gone
good.
to cancer stuff in a long time because I don't know if you know I got 6 kids, dude. I got
Wow.
2 boys, 4 girls. My oldest is 35, but my youngest is 10. She still believes in Santa Claus, so
Right.
I gotta keep
You're
up the
not old
charade.
enough to have a 35 year
I'm
old.
55, dude.
Well, that means you started early, dude.
I did.
I
I
didn't
was
have my
12.
boy. Yeah, I got a 4 year old and a 19 year old,
See, I
and
spent.
I'm
Go
going
ahead.
on 52.
See, I spent almost
Yeah.
12 years in the army, so I was a combat medic for a while before I became a nurse and stuff. So that's why I'm so
Well,
kooky.
that's why ER suits you.
I love it, man. I love it.
I know.
I was a trauma ICU nurse for a while, but and I like trauma ICU, but I love ER even better. But I had to step away
Hmm.
for a while because I was not really getting burnt out, but I don't want to be that jaded nurse because I have a smiling personality. I'm always pretty much nice
Hmm.
and stuff, but sometimes I was getting a little bit jaded, so I needed to walk away. So I stepped away for a while, but I'm coming back. I
Well,
like it. I
that's
like
why
nursing.
that's why I got into trials because I was a hemonc nurse for so many years and been there, done that, even with new treatments and learning. I just got kind of like sort of bored with it,
Right.
and
I
then I
get
like
you.
started like to get interested in trials. So I was a study nurse initially, and then I went to the director, um, and I said, this department needs a help. You all are running around like with your heads cut off here and
Right.
you're disorganized. I said, right now they had a southern manager in San Diego, and we were considered the northern. So I said, I'll do it, but I want to be the manager.
Right.
And he said, sure, go for it. And this is the bummer. Don't ever do this. Like
Right.
when someone asks you, well, how much do you want us to pay you? And then, and I talked to one of my friends about this, and I said, and his nickname's Shiz, right? Brandon. And Brandon's actually the guy that brought me into nursing. I was gonna go the pharmacy route because I was
Oh
a
shit.
pharmacy technician for
Oh,
10
I got
years
you. Yeah.
prior to a nurse, but like I was more influenced and excited about the nursing aspect of it,
Right.
right? And I did infusion stuff for a community ambulatory infusion center over there in Blackstone, Dakota, where the original cancer center was for
I remember
community,
that.
and I was
Yes.
a supervisor there. So,
Yes.
what is CCI now was over there.
Right.
And like all the old folks are still like part of CCI. It's funny. I go there, it's like a reunion.
Right.
But anyway, I don't even what the hell was I
You were
talking about?
talking
I'm lost.
about Brad Brandon Shiz was telling you how not to ask for how
Okay,
much money you're gonna ask.
exactly. So he broke it down to me like this. He's all, okay, your staff, you make this.
Right.
You're a supervisor, you make this.
Right.
You're a manager, you make this.
Right.
So I said, okay. And I'm not greedy,
I
you
know,
know.
but you're working 24/7 as a manager. You're on salary.
Well, yeah,
Holidays,
I
weekends.
moved from hourly to salary and I was working 16-hour days here
Right.
and there.
That's why you got to ask for more.
Yeah, so I mean, I was stupid. I only asked for like,
135,000 a year.
well, it was close, but it
That's
wasn't
what
that.
I know, but I tell people that people think I'm crazy when I suggest that. But I'm like, look, if you're a manager, you're getting a salary, you're working 24/7, holidays, weekends, you're always on call. Get what you
Hmm.
deserve. If they don't want to pay you, then tell them to piss off. Like you
Right,
deserve it.
right,
Yeah,
right.
yeah. What's the worst thing they're gonna say?
No,
And then move on to something else. Then who cares?
but
That's why
what
I
I
love
told
nursing.
him, I knew that he had a max. He had a glass ceiling of what he would give me.
Well, I want
And
that max.
what no, but when I told him what I wanted, he just went right to the computer and wrote it, and I signed it. And I'm like, damn, that was too easy. I could have asked for
Right.
more.
See,
He
right. That's good though, but at least you got what you asked
hindsight,
for. Now that's
hindsight.
not. Is that at a different job or is that this job?
That's a different job.
Oh yeah, yeah. So that's good.
No,
At least.
I asked for more at this job because now I'm a director, and I honestly I
Oh
do
yeah,
everything.
that's good though. That's nice. Yeah,
And
I like you deserve
and
it though.
but as a director, I have complete transparency and visibility of the P&L as well too, right?
Right,
So I I know that I can't like right now, give raises, especially to myself, because
right,
it's just not there. And
right,
I'm not going to ask for it because I'm not
right.
greedy.
I know, but people.
I'm in it to win it. I started this thing to be successful. We have had a lot of hurdles that we've had to jump, and we're barely getting set up at our second satellite site. The first one fizzled, and it is what it is.
So
The P&L.
What can we do as a nursing community or just a community in general to help the Women's Cancer Research Network? What can we do to help you? Where do we go? What do we do?
The community, I don't know what the community can do. The community can basically become more involved and kind of do their own research and check it out. Go to these community events that are women's focused
But do you have a
and
website that I
learn.
can send people to?
Those are all in my slide,
Oh, I got you. I got you. All right. Okay.
all in
I'll
my
make sure.
slide.
I'll make sure we
But
post
like,
it though.
if you ask somebody, right now, like, who do you know in your personal circle, friends, family has cancer? 20 years ago, people would say, well, I don't really have anybody. Now,
Everybody.
everybody has somebody. My sister had
Yeah.
breast cancer. You
My
know,
mom had it
I
twice, double mastectomy.
yeah,
My
I
primary
had
care provider.
I had cancer.
Oh
I had
shoot.
cancer.
Oh,
Yep, 2009. I had a
I'm glad you're still with me. Yeah.
transverse colon Mott lymphoma.
Holy
So
shit.
it's an indolent, very slow growing. They found it on a colonoscopy. It was a, it looked like a polyp, but it was a cancerous polyp, right?
Right.
And in the lymph tissue. So they, snipped it out, so surgical removal. Um, and the pathology came back positive for, the cancer. They went in a week later after the pathology results to go in and clean the margins, which is a kind of I guess, a technique that's very common
Right.
for these types of cancers. So, stage 1E, so just locally right there, didn't like go into the colon itself. It was just kind of superficial in the lymph tissue on the.
But what do you mean? I know what it means, but tell everybody what you mean by clean the margins. What do they do exactly when they clean your margins?
So you have a tumor that in my case a polyp, so the polyp is removed. And normal, I guess, surgical procedure probably is to cauterize or something like that to, I guess, stabilize blood flow and all that kind of stuff, because you can't just cut something and then take it out and go. So they're
Right,
gonna
right.
stabilize it and get it to kind of like stop bleeding and whatnot. And then they send it to pathology. And now that they know that area where they took it out, and they map the area, they know where it
Right.
is, it's documented. It's kind of like, and transverse colon is kind of simpler too, right? So
Right.
that's the colon that goes straight across this way.
Flatter
You
and
got
larger.
ascending, descending,
Right.
transverse. So,
Right.
they know exactly where to go back in, and they go back in and they basically kind of
Cut a little bit
more or
more out.
less rotor-rooter around
Right.
where they were at, to make sure that it didn't, penetrate into the colon more.
Right.
And it's just a smart safety measure per
Right.
se.
Right.
So
Did you have to have any chemo or any other treatment?
I did not, but the local doctors did send me to the lymphoma specialist in San Francisco, and I felt good about, what he said. And he basically said, no, you're just going to be on a surveillance. You're going to have a upper and lower GI every 2 years and a PET scan every 5 years.
Right on.
And that's been my treatment since 2009, and I've
And
been
everything's
clean.
look good. Good. It's good.
Absolutely. Yep.
Yeah. Yeah, because my mom
Yep.
had breast cancer twice. I shouldn't say, I don't know if it's once or twice, but she had it in one breast, and then they had to go back and remove the other breast. And then
Mm-hmm.
I won't mention her name because I don't want to embarrass her, but my own primary care provider, she's a lady. I just found out she had breast cancer, so she's going through cancer treatment and stuff. So there's a lot of people I know. The guy who helps us keep the office clean, his wife died of pancreatic cancer. So
Mm-hmm.
it's crazy, man. Like,
Cancer doesn't care what you do
yeah,
for a living, who you
yeah,
are.
that's right.
I've
Look at
taken
Steve
care of
Jobs.
many nurses and many doctors in my
Yeah,
career. And it's funny, the ones that end up in my infusion chair, the
right,
who've actually have worked with, that I
right.
know personally.
Who used to be assholes to you?
Not necessarily,
I know, but there
not
are some of them. But
necessarily,
that cancer will
but
humble you, won't it?
but absolutely, and
Yeah.
you're right. That has happened, but I personally I haven't had it happen. I've had good
No, I got you.
good experience. And it's been nice to see that side of them per se, because now you have them with you. They know that you care for them, and you're one on one and being compassionate with them. It's great. I love
Right.
it.
Yeah.
You
So,
know,
so if I
they have
wanted to,
more I guess understanding of what you were doing for their patients in the area
right,
where you work with them.
right,
Absolutely.
makes you appreciate you more.
Yes, sir.
Yeah. So if I wanted to be a cancer care nurse and work in infusion center and administer chemotherapy, what would I have to do as a nurse? What would a nurse need to do?
Um, the easiest answer for that is to get your chemo and biotherapy certification.
Is it
That's
actual
gonna
certification or is it a class?
It's a class and a certification that you
Like,
get
is it a
after
national?
taking the
Is it
class.
like a national certification?
More or less, yeah.
Okay,
It's an organization that provides that for people. And
gotcha.
then there's the the OCN on top of that. And but right now, the general, I guess, requirements are to have the biotherapy and chemotherapy.
All right.
And it is through ONS as well, I believe.
Which is the
Don't quote me.
Oncology Nurses Society. Yeah,
Nursing's
I got you.
correct.
I'll look it
Right.
up and put it in for
So
everybody. Yeah.
that's absolutely, I'd say, the first thing to do if I was a nurse wanting to get into oncology. And you know, there's so much turnaround
I
and
know.
need here and there with
I know.
staffing, people, nowadays it's kind of like, when you apply somewhere, it's unfortunately not as personal. It's
Right.
like all online.
Right.
There's no like calling the manager saying, "Hey, this is Michael. Wanted to talk to you to see where you're at with your staffing. I'm interested
Right.
in becoming a nurse
Right.
with your program there.
You got to go
Are
through
you
HR recruiters.
right?"
Right.
Exactly. It's very, very disconnected. But
Right.
I'm old school. I don't care. I would still go there.
So
You know,
I tell all my students that I don't give a shit what they say. You go down, knock on the door, and say, "Hi,
yeah,
Mr. Michael." What's the worst thing they're gonna tell you?
they're going to tell you no.
But
The
keep going
squeaky
back and
wheel
tell.
gets the
Yeah,
the
I tell them
squeaky
keep
wheel
going
gets
back.
the grease.
Right, keep going back until they say, "Leave me alone."
Yeah. You know what?
I mean,
That is like the most important to instill in
yeah.
new nurses is to, I mean, you can't teach it, but they
Right.
have to be assertive and confident.
Right.
And I know that comes with like time and wisdom and experience, but
Right.
you know, there's just the social skills that people have nowadays
Right.
are so lacking compared to us and our generation
That's
because
because.
we just we just don't, yeah, exactly, they're like
Right.
they're like boobs on the boob tube there,
Right.
and we don't give a damn. Like I'm very thick skinned. A doctor's
Right.
going to yell at me and I'm going to think, huh, what a jackass.
Right.
I don't really care, because
Right.
I know that, like, I try to make intelligent questions. I try to look for the answer before I ask for the answer. Do you know what I
Right.
mean? And I think that nurses need to be taught that at an early stage
But they're
because
not taught that
you
anymore.
no, they're not.
Right.
But I did. I taught
I
them
know
that
you.
when I
I
was at
know.
City College.
Yeah.
I did. I swear to
I know.
God, I threw it in there. It wasn't part of the curriculum, but it was part of what I was saying.
I think it's important though.
It's
Yeah,
it's
I agree.
vital.
Yeah.
It's
I think
vital.
that's why we're in a I think that's why we are in the situation we're in now with nursing because we don't teach nurses to think that way and look information up for themselves and stuff. So
Yeah.
yeah,
You
it's
know,
good.
my niece has a multitude of problems, and she had called me over to Clovis because she was in the ED, and she had pancreatitis,
Oh man.
and they were going to put a Salem sump in her, right? Most that's which is what the most comfortable tube you can shove in
Right.
somebody,
Right.
right? So I go there and I'm talking to the nurse. Her nurse is like been a nurse for like a year in ED, right? And she worked as a manager at Pizza Hut before that or something, right? So I'm like, oh Lord.
Oh
So
shoot.
she has I guess, an experienced nurse come in and she can't get the Salem sump down her, right? And then she finally grabs it and I don't know if you've been in this situation because you're a nurse. It is so hard to just sit there when you're not like on the time clock and just like take over and do it, right?
Right.
I just want to like move them the hell out of the way
Yes.
and do it myself, you
Well,
know?
I had the same problem with my son. He was downtown in their pediatric floor because he was started on Remicade
Oh,
and then he went on to get Humira, and now neither
okay.
one of those are working. So now they're trying Inflectra because he's got ulcerative colitis,
Okay.
and they sent in a brand new nurse who never has stuck an IV in him, and they nurses don't understand anatomy, so she stuck it in his arm like right up in here, and she blew through the vein, and then she comes over here and sticks it and doesn't leaves the tourniquet on and blood's getting everywhere. And she calls on her whatever the little stupid phone is. I need some help in here. I need a 2x2. I'm like, why didn't you freaking bring this stuff yourself, lady? Like what?
Really?
Yeah, I'm like, and
Wow.
I'm over in the chair going, Lord Jesus, please give me strength and patience. Because I don't
You
know if you know this about me, but I am a vascular access board certified nurse. So I teach this stuff, and it makes me crazy because I'm like,
Well, you know what oncology nurses are, right?
no.
We kick asphalt with starting IVs.
Oh
That's
yeah,
all
yeah.
I
I mean,
gotta
yeah,
say.
because that's all you're doing stuff. Yeah,
Yeah.
yeah, that's true.
And
Yeah,
who are the best? The best are oncology nurses and ER nurses.
right,
Sorry.
right.
You know,
But that's because we do it all the
I've
time.
had patients come to me in the clinic and say, "Yeah, I usually need an anesthesiologist to get my IV," and I'm like,
Yeah,
"Okay," and I'm just like, "Boop."
right, right. I know. I love it. I love it because I take pride when I start my IVs and stuff. Because I
You
want.
know, and this is kind of sick, but not sick. You know, it's and I don't know if you, I'm not, I shouldn't be saying this, but like
You're
my
fine. You're fine.
thrill, my thrill is to have like a patient, and I'm not saying I want ill harm on a patient,
Right,
but
right. I got
you
you.
know, um, my thrill is to like have one of my nurse buddies say, "Hey, four of us just tried on this patient, and we can't
Right,
get an IV," and I just go over there and go, bloop.
right. I love that. That's my. And like, how come they didn't call you first? I'm like, I don't know. I ask that all the time.
No, and it's even better when they go, "Oh, you got to use a 24. They ain't got nothing."
Right.
And then you put like, at least a 22 and
20,
it's like,
right.
"Yeah,
I do. I love it too, man, because I love it. I love
yeah,
IV therapy and stuff.
yeah,
And so last question, and I'll let you go because I know I've already kept you here an hour.
no worries."
Um, so Pete, I don't know if you remember Pete from I don't know if you know who Pete
I
is.
do.
Yeah,
And I looked at his podcast and you got to do him again because it was kind of noisy.
I'll do him again. I'll interview him too. I love
And
Pete.
you know
Like
what?
Pete,
Tell Pete, do you know him personally?
I do. I love Pete.
So
Pete's a
I
beautiful
was
soul.
You know what it is like when there's all these women in the room because like most nurses are women, right? We're
Right,
outnumbered.
right. We're
So
a
with
minority.
oncology, it's even worse,
Oh
There's a
shoot.
majority that are just women. So, I was like leeching onto the dudes there. I'm like, oh, there's another guy that, oh, you're an oncology nurse? Cool. Where do you work? And blah, blah, blah. Like Pete was like hanging out with you, and I didn't even know what he did there. And then I saw his podcast. I'm all, oh, snap. He's one of me.
He is.
Like we should have been best friends. So tell him I am sorry that we didn't hang out and talk
I'll
more.
get you connected with him. I love Pete,
Yes,
man.
sir.
I'm not
No,
joking.
he's
Pete
cool.
is a
He's good
beautiful
people.
soul, man. Yeah, he's a
He
beautiful soul.
is. He
Oh,
is.
so I ask you the same thing I asked Kim. Why? So this is the biggest problem because I told you I teach infusion therapy. So a lot of your I don't know if a lot, but I would say many of your patients have some kind of implanted vascular access device or a Mediport is what we call it, a Mediport Porticad.
Right.
Why don't nurses, why should they and why don't they access those ports? Why do they insist on stabbing people when they have access to these devices so it's better for the patient? What would you say to those nurses who don't know how to access those ports?
Be proactive. Go get trained and signed off. Find out what the protocol is for your institution and get it done. Have that skill. Stop torturing your patient.
Do you think we
They're going to come in very sick and you're going to have an extremely terrible rapport with them because they've been told from day one, this is the best thing since sliced bread. Your nurse will be able to give your medication in there, take your blood, blah, 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 blah. You have a dual lumen port, even
right,
better money. You can get all kinds of stuff in there.
right,
And then they go to the ER or wherever. Oh, we don't touch those. What do you mean you don't touch them? Aren't you an RN? You
right,
got the same initials as my oncology nurse.
right.
So,
So do you
fun,
think
fun, fun fact.
hospitals
Let me tell you
all
something.
right, go ahead.
I got a story on this. So, where did I learn? So, I started as at UCSF in the SNF, inpatient SNF. Didn't really get much action there. Left that place after a year. Went to Leonis Peters in
Right, right,
CRMC, and we saw him once in a while. And I went to the boss. I said, "Hey, I want to access these things. How do we do this?" "Oh, you got to get signed off 3 times." So I went to my homies in home health and I went to the oncology floor and I got it done like
right,
in a month or less. And then I was signed off. I was done. I was competent according to the
right,
policies of the
right,
hospital, and I did it. But people aren't proactive like that.
right.
you
But do
know?
you think do you think hospitals have policies that say don't access them, or do you think they just have policies say we just want to make sure you're competent when you access them? Because I don't remember
I
any
don't think
policy
there's
at
a
St.
don't.
Agnes.
Right,
I don't remember there's any policy at St. Agnes that said we can't. I don't even remember that you had to go through any competency training.
right.
I don't. I
Well,
don't know that to be true,
CRMC,
but
at the when I worked there, and I haven't worked there since 2012, by the
right.
way. I'm dating myself.
No, I got
Um,
you.
you had to be checked off. So
Right.
was that common knowledge? Probably not.
It wasn't common back then, though. That was the thing. Like we
Right,
didn't put them in people as often as we do now, though.
right.
Like it's
But
common now.
honestly, every floor should have somebody trained to do that. Every
Right.
single floor, period.
I agree.
You
Yeah.
know,
Because why would we put them into patients if they weren't necessary? And then you're
I
stabbing
mean,
patients unnecessarily.
honestly, they're just more common now,
Right.
period, because they have like chronic conditions, they're getting chronic IVs, and they're like they're sick of it, or
Right.
the nurses just run out of options. Well, the nurses that don't know how to start an IV, right?
Right.
And
I
and
love
uh
it.
and then they put it in, yeah.
Yeah. I love
So,
it. All right.
yep.
So is there anything you want to share with us? Anything you want us to know about you, your network? Anything else you'd like before we wrap things up?
Well, yeah, I mean, Women's Cancer Research Network, like I was saying, how it came about. So, why are we here? The simple answer is, without having like a robust clinical trial program in an area, and we're focusing on breast and gynec, those patients have to go to UCSF, those patients have to go to UCLA, they have to go to Stanford. That's a taxing effort for
Right.
families. And what happens there? The physicians sometimes lose their patients.
Right.
They'll end up just seeing that principal investigator at the academic site, and it's bad for local business.
And
And
you're here locally.
I am here locally, but
Right.
we are trying to have a local, regional, and national footprint.
I got you.
You got to start somewhere. We're
No, I
starting
got you.
local.
All right.
Yep. And you know, we just have to have more opportunities here in Fresno, period,
Right.
because everybody's running out of treatment options and we have to bring them more options, and
Right.
those are only done through clinical trials. you know People should understand that this is the research is a necessary evil for evolution of medicine.
Right.
you know we have new medicine now that's targeted therapy because of people that have participated in clinical trials.
Right.
If you're not doing it for yourself, because depending on the trial design and phase, there could be a benefit for you.
Right.
Um, you're doing it for your sons and your daughters, or your
Right.
granddaughters or
That's right.
grandson,
That's right.
or just somebody else,
I
period.
appreciate that.
And
I appreciate
yeah,
that. Yeah. So my mission, no joke, I want to start an infusion center here in Madera. People laugh at me because they're like, "Who wants to come to Madera?" But we need these, we need these facilities to help people, and I don't. So that's my mission. So if you ever want to help me, even if it's a cancer infusion center, I'm okay with that.
no, I'm down. I can at least help you design it, and I can help you get per diem staff, because I know everybody, and
I know.
you know a few people.
Right. All right.
Absolutely.
I appreciate you, man. I appreciate you taking your
Uh,
time out of your morning, and well, I'll let you know, and I'll send all this stuff to Mackenzie too, so she can use it as well. And I appreciate you spending
Absolutely.
your time, and I hope we get to see each other again. And I'll hook you and
Yeah.
Pete up as well.
Well, hey man, like invite me, have a panel discussion with a
I
couple
will.
nurses and some
Yeah,
topics,
I
invite
will.
me,
I will.
whatever's relevant. I don't know what I can,
No,
my experience,
I
so
have a friend that I work with now. Her name is Maggie Ortiz. She does legal nurse consulting and legal charting. And so we're talking about having a conference in the summertime. So if you're interested, I'll let you be if you want to be a part of that. Seriously.
yeah,
Yeah.
absolutely. Hit me up.
All right, man. I appreciate you.
All right, Kevin,
All right,
have a
man.
good day,
You
sir.
too. You have a good day,
Take
man.
care.
Thank you very much.
Uh-huh.
You bet.
Don't miss out. Engage with us weekly. Share your thoughts, and let's transform the nursing landscape together.